CCT monthly meeting. Can't believe we almost May of 2025, so time is flying. Okay, so welcome and continue to put your name and organization in the chat as we, continue our introductions and thanking everyone for attending our meeting. It's always a pleasure to see you and welcome you back each time.
And did my slide advance, Tornisha? Or is it still on the?
Yes, your slides. Yes, no, it didn't. It's still on welcome. So if you can move to the next slide. Oh, your screen is gone. Okay. It's still on the welcome slide.
Okay. Is it moving now?
Still on the welcome slide.
Okay, well, let me go ahead. I'll PDF the slides, but if folks would like to go ahead and introduce yourself with your name, your organization, and how can the CCCT support you this month?
If you want to just come off of mute and say it, that's fine as well. So please don't be shy. No one? Don't have any ideas how we can help you this month? I can't believe it. So
maybe I'll have some toward the end of the meeting once the ideas start flowing and conversations start happening. Maybe toward the end.
Okay. Anyone? No problem. Dr. Blunt. I know so much is going on. You see so much is on the news. We don't have any money, so we can't help that way. But Dr. Carter is always looking for funding. So just wanted to see, make sure we have this opportunity to see how the CCT can help the community organizations and the residents. So any ideas, please come off of mute and speak.
Maybe it would be helpful to know what the CCCT can do aside from these monthly meetings that provide a great opportunity for networking and sharing resources.
Sure. So we're always looking to see what's going on with the community and how the CCT can help with care coordination to help the needs of the residents, what the residents needs and related to healthcare, social needs, bring in partners together to kind of brainstorm. And I know we started talking about, creating this resource toolkit for like the Spanish speaking and Latinos community patients that we see now that's being sent back to different countries. So what are those resources that we can help with? Because now we see that they're scared to come to their doctor's appointments. They're not attending going to the food pantries. So what are some of the things that we can do to make them feel safe and to make sure that they still get the health care and education and the resources that they need? So that's just an example.
Does the CCCT now have staff that can actually help with the direct care coordination with patients?
So we're trying to connect people, resources. We're still trying to build an infrastructure. We do, until if you want to kind of expand on what we have the interns doing and what we're doing with the toolkit. And then like if we get questions or requests in, how we can navigate to get them connected. So we don't have the full infrastructure, but we're trying and we're trying to see what are those needs and where are the gaps so we can fix that if we could. And Dr.
Yes.
Carter and Teller, please add, if you have any additional information you'd like to share.
Gotcha. So the question is kind of what could the CCCT do to support us if there was infrastructure and staff?
Yes.
I understand. Okay,
exactly.
Okay. Yeah.
No, that is exactly right. Yeah. So what is the CCT? What are we trying to do with the CCCT? Well, we know, and especially with the change in the sort of the ecosystem of public health, the CCCT is looking at itself and saying how do we build the infrastructure needed to help the communities that we serve? And those communities are not monolithic. They turn out to be very varied, so what works in one community may not work in another. And so we know, number one, that we need to have a platform, some infrastructure that can help us in terms of the standard ways of going about doing things, meaning the evidence-based ways. But how do we make sure that it gets in the community to be tailored to the specific needs of a community? So it's a very multifactorial problem. So we're gathering information right now. We're in the information gathering phase. It's not that we don't have in the back of our mind an infrastructure or a model that we want to set forth. But before we set that model forth, and I will tell you, it has to be a dynamic model. It has to be a systems-based model. So it has to be a systems of systems model, because you have these little systems and you have this broader system. And we're trying to think through, how do we create a resilient system? That means it's bulletproof to whether the federal government goes one way or the other. How do we create a bulletproof system so that we can help the people we're trying to serve optimally with the infrastructure that we have to create, because it's not there, as you all well know? And how do we make it sustainable? So every time we have a meeting at the CCCT, we're gathering that information. We're thinking through, we're listening. We're in the sort of the listening and planning mode. And at some point, we're going to share that with you all so that you all can give us the dynamic input that we really, really need. But right now, we're sort of formulating it, and we're bringing in speakers and different people who are telling us about how to address that. And every time you all talk to us, every time you say something in one of our meetings, we take that very seriously, because it has to be part of our dynamic model. Now, to build a dynamic model takes a lot of time, and it takes a lot of inputs, and it takes a lot of thought. So hopefully you all, and it just warms my heart to the fact that you all come to these meetings and you all share, because that helps us think through it. And I know you all are thinking through it too. So when we come together collectively for a solution, it gives us a much better chance of being successful. So, because a lot of solutions we have, like these things that trickle down from the federal government, we get this funding from the federal government. We go out and the government says we need to do these projects and they need to look this way, and we're looking for you to have these outcomes. That's not the way you're going to really change the community. It has to be changed from the community up and not from the federal government down. So we know this. You all in your heart of hearts know this is true. So now we have to build that infrastructure. And I can't say today, I'm going to show you how that looks, but I'm going to tell you for sure that we're going to build something that we believe that'll work, and then we're going to try it, and we're going to find the funding for it.
So that's, you have another question?
Sorry, yeah. Ms. Stokes, what was that to me?
Yeah, sure. I see your hand raised. I was asking if you had another question.
Not a question, but an answer to the question. I'm going to pick up on something that Sharon put into the chat, helping community to use preventative care in lieu of the emergency department for the first point of continuum of care. If there's anything that the CCCT can do to support mobile integrated healthcare at fire EMS, that was for a stretch of time pre-pandemic, and I think an incredibly effective way of identifying high system utilizers through the 911 calls, right? They had direct access to identify who were the high system utilizers who were calling 911 on a frequent basis. That's not exactly the same population as people who are using the emergency department for their primary health care, but I think there's probably some overlap there. And being able to provide the case management and the care coordination to get those people connected to both preventative care, but also sometimes just social supports that reduced that 911 effort. I know it's been a while since I've spoken with China Pinkney about the mobile integrated healthcare, but I know that she has largely been overwhelmed, and it's been difficult for her to like coordinate with our street outreach team, which there used to be very close coordination with our street outreach team at the continuum of care. So I would just suggest anything that can be done through the CCCT to provide support for mobile integrated healthcare, I think would get to exactly or would get to some of the clients or patients that Sharon was elevating in the chat.
Just to
Good
add to your
point.
point,
And I know.
I'm sorry.
Go
Thank
ahead,
you so
Sharon.
much for responding to that. I sat in on an advisory board meeting yesterday with the University of Maryland Medical Systems, and it's a significant number of individuals who are coming into the emergency centers or departments, and it's not the appropriate setting for the appropriate care. And then those are the individuals that you find are complaining about the length of times in the emergency room. So how, looking at strategies and working in conjunction with this particular body, along with the University of Maryland Medical Systems and other hospitals within the region. So how do we, strategize and, helping individuals through our health literacy to educate them so that they know that this point of care is not the appropriate setting for the appropriate care. And this can, this is again, re-educating, reimagining healthcare so that individuals understand that preventive care is the point. So going in for a minor cut or a headache, again, how can we work together? And then, connecting these resources, as Dr. Carter had mentioned so beautifully before, in ensuring that the right individuals are being seen at the emergency department, because we're finding in that particular setting that the majority of those complaints about the emergency room waits are related to those individuals who are there and through the triage process, being sent home. So they really are not, appropriate for that setting. But thank you so much. So if you can, drop that information in the chat, I would love to share it with Nate Richardson, Mr. Richardson over at the medical systems, and we can work together in coordinating something.
Sure. I don't know that mobile integrated healthcare itself has the bandwidth to be able to assist with that, but maybe there would, since we're talking about building infrastructure, maybe there would be a way to identify using that mobile integrated healthcare model, instead of identifying high system utilizers through the 911 system, using identifying high system utilizers through the emergency department intakes, and offering them, because mobile integrated healthcare was voluntary, but offering them some case management or care coordination, which for MIH was clearly reducing, I mean, in many, many cases.
John, you went on mute.
Oh, sorry, accidentally hit the space bar. They were reducing 911 calls by sometimes 90%, 95%, just by providing some care coordination with those individuals. And again, voluntary care coordination, it's not going to be the right fit for everybody, but maybe there's a way to adapt that model for a similar system, but identifying the high system utilizers in EDs instead of through 911.
No, we actually work with Mobile Integration Health under a program. We have Health Department Prevention Link 1, where we had our CHWs. There was patients that they would refer to our remote patient monitoring program, or either our diabetes prevention, and what the CHWs found at that time, that at that point they needed something more because the patients wasn't able to do like their daily living activities, so they wasn't attending the classes. They wasn't taking their blood pressure. Some of them wasn't able to see, was losing sight, and there was like husband and wife who was trying to take care of each other. And so a lot of those patients at the time needed like home assisted living assistance at the time, home health nurse. And some of them needed like food on meals because they was just worrying about where they was going to get their next meal from. They wasn't eating healthy. So it was good that we was able to see exactly like what those participants in that program need. And at that time, it wasn't what Prevention Link those services, but thank goodness we have CHWs that can connect them to home health aides, get them Meals on Wheels for that program in. But I definitely know that is a need, and we do hear you. So I wrote that down and to see what resources we have, and we still do have CHWs, and I know TLC has some CHWs as well. So maybe we can just look at that connection, how to help those patients while health literacy and healthcare needs and other social needs to kind of eliminate or decrease those high utility rates to the emergency room.
I will tell you all, and I don't mean to hold up the meeting, but when we did the health enterprise zone, when I first came to the health department, that's how the CCCT came about. It was once we did the health enterprise, we created the CCCT, and we put and this is an ongoing thing. We put in place we connected community health workers to we determined from the CRIS data who was overutilizing their emergency room in that zip code 20743. And it turned out to be 10% of the overall admissions were people who were readmissions. And we also found out that there's about 3% who were overutilizing the emergency room for reasons that were, and we targeted those people and we gave them community health workers, and we got the data, and we were able to show that we could reduce the emergency room visits by an average of about 35%, and we could save the hospitals $8,000 per person we intervened with. So when you look at $8,000 per person, if we do 100 people, we've saved a lot of money to the hospital. We couldn't get it sustained. So that's why Prevention Link came about, because we went for federal money so we could try to sustain that model. We at that time when we created the CCCT, we invited mobile integrated health, and then we integrated them in, but we weren't able to do it in a systematic way. We weren't able to get the support from the county, which we needed. We needed the more support from the state, which they abandoned the whole health enterprise zone, which made no sense to me. They put money in it and then they completely abandoned it. And so we know, that's why we know what to do. We have, and everybody on this call knows exactly what we need to do. We have to have a sustainable model to do it, or we'll do it again, we'll get results, and then it'll go away. And it'll go away because we don't have the investment from the. We don't have the. My whole tune has really changed. I really think if our communities are activated and they say, and we make sure that we're the trusted source, and they say that, and they know we're helping them, they will demand that it's sustained. That will be we can't for the health department or other people to say we want this to happen because we can see it. It falls on deaf ears. I'm just going to tell you, and of course, your political winds just blow one way. You have one governor and another governor says they want to do another thing. You have one county executive, another county executive say they want to do this. You have one president that wants to do one thing and the other. And then these projects which show results. I mean, you all have done projects, I know, that have shown results, but the bottom line is that we're not able to sustain them. That frustrates me. I honestly believe we have to be at the community level, and I have some other ideas I want to talk to you all about in future meetings, how we might be able to get it sustained. But that's what the bottom line is, because I know the University of Maryland, before it was the University of Maryland Capital Region, when it was Prince George's County Hospital, they had community health workers in the hospital. They were, we've done so many things. So I'm just going to leave it at that. But I do know that we are the group to be able to do this. In Prince George's County, I believe it can happen, and I'm going to work really hard to do it. And I'm going to stop because I'm getting the eye from Taylor and
Jay, I see your hand, so I don't want to ignore that.
Yeah, one more quick comment. We're in the middle of rewriting our strategic plan to prevent and end homelessness, our 10-year plan. So we're deep in a strategic planning process. And we've had a number of meetings where the power of community civic associations has been brought up as a way to, in our case, engage the community about issues around homelessness. And I was astounded to find out that there are literally hundreds of civic associations in Prince George's County. Every county council person's district has listings of civic associations, and those civic associations are extremely active. And I'm wondering, as we're talking about building a grassroots movement to essentially demand funding for better care coordination, maybe the broadening our scope of community in that community care coordination effort would be helpful. That inviting those civic associations, and they're very active members of that, are frequently people who have been in the community for a while and who are retired and who could potentially come to a meeting at 11 o'clock on a Thursday, right? Like that's it. There is a lot of overlap, I think, between the activity of those groups. And they've been we had a street outreach navigator who did a lot of outreach into civic associations and homeowners associations, and they were very responsive, explaining issues around like how people become homeless, what's the right response to homelessness. He generated a lot of energy and a lot of goodwill that resulted in us getting care and services to people more quickly. Maybe that's a resource that could be tapped into here as well.
Thanks for sharing that. And actually, I just was riding the other day and I saw the sign that says Lago Civic Association. So we'll definitely be reaching out to see if we can connect with those organizations and invite them to CCT.
Yeah, the every county council person's office has a constituent services coordinator.
Okay.
For example, in Jolene Ivy's office, it's Nikki Greco. She works very closely with us on a number of different issues. She was actually the person that pointed us in that direction and was able to show us on their website the 27 civic associations within Jolene Ivy's district. Or not Jolene Ivy, because she's at large now, but in one of the districts. And so the constituent services officers in those county council person offices would be exactly the right person to talk to get tapped into that network.
Okay, thank you so much. We will follow up.
That's great. That's good.
I know we have some guest speakers. I'm so sorry that we kind of went on a tangent, but I think this was good open discussion and things that we can take away. So I'll turn it over to Taylor so she can move and transition into our guest speakers today. Definitely want to allow them time to present and share their awesome
Absolutely.
presentation.
Alrighty, well, we will go ahead and jump into things and welcome the Maryland Healthcare Commission to present the Maryland Quality Reporting Resource Tutorial. I saw this resource a few weeks ago during a health literacy presentation. I know that the MHCC has done a lot of work to increase the accessibility and the usability of this online resource. And so I know there are new accessibility features and just really great content that is able to be accessed through this website. We thought that this was the perfect audience to receive this presentation today because of the care coordination efforts that you do in the field and trying to understand your care coordination processes and how we can add this resource to your referral processes. So I will go ahead and pass it over to our guest speakers today.
Hi, good morning. Thank you so much, Taylor. My name is Courtney Carta. I work at MHCC. I am joined by my colleagues, Sumitra McCammon and Teresa Lee, and I think a few others have joined as well. So I have a quick PowerPoint presentation today to talk about our quality reporting resource tool. Are you able to see my screen?
Yes, we can. You're not in
PowerPoint.
PowerPoint. You're not in presentation mode just yet, but we can see it.
Okay, how about this?
It's still
see
loading
slides?
on my end.
Okay.
Not in presentation mode just yet.
Great, let's see. How about now?
Still not on my end. Anyone else seeing in presentation mode?
Not yet. No, not yet.
All right, let me try one more thing.
I think Teams is just having a day.
You know, every platform is a little bit different. I will try to move it to a different window and maybe I'll have better luck. All right. Okay, well,
You may have luck. You may have to PDF the slides and unfortunately just go through
Okay.
it like that.
So, you know, the slides are kind of the boring part of the presentation anyway. So I can kind of just talk through those quickly. And so the main thing I'm going to talk about today is our quality reporting website. And so let me try to see if I can share the website itself. Can you see the website? Okay.
Yes.
All right. So
Yeah.
let's start there. So I'll just give you some quick background about the slides that I was going to share. And I can send these to you, Taylor, so you can send them out to the group so everyone has the reference. And so my name is, again, Courtney Carta. I work at the Maryland Healthcare Commission. And so just a little bit of background about what we do. We are a state regulatory agency, and we fall under the umbrella of the Maryland Department of Health. And our system is to plan for health system needs, promote informed decision-making, increase accountability, and improve access in a rapidly changing healthcare environment. So that is a lofty mission. And in order to do that, we need to be able to provide timely and accurate data on things like availability, cost, and quality of healthcare services. So we are really excited to be here today to talk to you. I think I heard the word community about 50 times already. It's in, I think, a lot of different of your titles in your organizations. And so you are boots on the ground, you're doing the work. And so you all are exactly the groups that we want to reach, because we want to share this tool with you so you can take it back to your communities and use it as needed. And so at MHCC, we are required to publicly report healthcare quality data to consumers for a number of different healthcare settings. So that includes things like hospitals, nursing homes, assisted living facilities, hospice, adult medical daycare, home health, outpatient surgery, and health plans. And so we have a lot of different types of resources for those settings. And we have a team kind of dedicated to these different healthcare settings. I think most of us are on the call today. We all have different areas of expertise. And we want this to be a discussion. So if you all have questions, maybe that I can't answer, teammates are also on the line, happy to jump in. And so in order to be able to provide this data, we get data from a number of different sources, and we want to make sure we're reporting data from trusted sources so that consumers feel confident and can really help make informed healthcare decisions when it comes to their healthcare. And so we get data directly from federal agencies such as CMS. We work with other state agencies like HSCRC and the Office of Healthcare Quality. We administer some of our own surveys each year, and we get data directly from health plans and other reliable sources, because we really do want users to feel confident that the data they're looking at and using is accurate and up to date. So I'm just going to jump right in since my slides are not showing. But here you'll see the homepage on our website. And I want to point out a couple of options we have for accessibility. We can make the font larger. And we also have the ability to translate the website into over 100 different languages. And so we have a couple of resources here at the top that I will get into a little bit later. Oh, and then one more thing, we have some kind of new hot topics, interesting information right here on this black banner. So if you want to learn more about COVID or the flu, you can click on any of these links here at the top. We also have a search bar. So if you know exactly what you're looking for, you could type it in the box. And just below that, we have quick links. And so these are links for things we get a lot of questions about, things that we want users to be able to find quickly, hence quick links. And so price, unfortunately, is a top question we get. So we have a number of different links for different types of healthcare settings on rates and prices. We also get a lot of questions on how to file a complaint. That is not something we handle at our office, but that's important. So we want people to be able to get there quickly. So these links will kind of take you to the appropriate agency based on your needs. Same with health insurance. And then we also have information on advanced directives and telehealth. Okay, and so the heart of our data really lies down here within these different icons. And so I want to use an example today. We're going to go through nursing homes. So just imagine you are maybe an adult child, your mother or father, they are kind of heading towards, maybe you're looking for a nursing home for them. And so this is kind of a difficult decision to make, right? And so I just want you to kind of imagine you have a number of siblings. Maybe you want mom or dad to be central so that everyone can visit, maybe take turns. And so that's kind of the example we're going to use today as we walk through this website on how you might use the information we have. And so I'm going to click on this nursing home icon here. And this will take you to a number of different options. So first, you could find a nursing home near me based on family surveys and quality ratings, staffing, or daily rates. So these are 3 topics that we've heard from our consumer focus groups that are really important for people to consider. Perhaps you have a nursing home in mind. Maybe there's a facility that you drive by on your way home from work. Maybe you're interested in more information. You could start here. Or maybe you need particular services, maybe Alzheimer's care or a secure Alzheimer's unit. You could start here. And these 2 options I'll go through a little bit later. They're more resource-based. But for today's example, I want to start with, I need to find a nursing home based on family surveys and quality ratings. So I'm going to click here. And this will take you to a list of all the nursing homes in the state of Maryland. So that's over 220. So you likely don't want to review 220 nursing homes. So we need to filter down. And so we have options at the top here. So again, you could filter down by services. You could search by name. You could search by zip code, distance to that zip code, or by county. So if I choose Prince George's County, this makes our list a lot shorter, but there are still a lot of options. So I looked at a map, and I'm going to use a Largo zip code because that is almost geographically kind of in the center of Prince George's County. So if I do the zip code, there's one in Largo in this zip code. And so that doesn't give you enough options. So we can expand our distance a little bit. So within 10 miles, now we have 6 or 7 options to choose from. And so we can see an overall kind of summary measure of satisfaction ratings from the families, overall care, and then some star ratings. So these come from CMS Nursing Home Compare. And you can filter, or you can sort each of these columns by high to low or low to high. Anything that you're most interested in, you can sort. So now each of these facilities has what we call a profile page. And so if we click on any of these facilities, it gets to the individual profile page, and we can see some basic background information, where it's located. We can click on this picture, and this is actually the facility, so you get an idea of what it looks like before you even go. And then we can scroll down and we can see some basic information about the ownership. We can see some star ratings, toilet configuration, number of beds. It'll give you an idea of how big the facility is. We have room rates. And then we can also compare this to Maryland. So if I clicked on that Maryland average, now we can see how it compares to the state. So lots of information. But really, we can keep scrolling, and now we get to kind of those ratings, the rankings, how people view the facilities themselves. So if I click on any of these topics to expand out, it gives me more information. So you'll see an information button for most of these, and so it'll give you kind of a description of what you're looking at. So the Family Satisfaction Survey is the topic I clicked on, and you can see that MHCC conducts a family satisfaction survey called the Nursing Home Family Experience of Care Survey. These results are available to assist Marylanders in choosing a nursing home. So that's what you use these results for. And we can see how the facility scores compared to how the state scores. So there's lots of different ratings and measures. We have these two at the top bolded because these are two measures that people look at a lot. Would the family recommend this nursing home? And how would you rate this nursing home overall? So they do pretty good. This facility, 96% of the family would say, yes, we do recommend this nursing home. And that's much higher than the Maryland score. So that's pretty good. Same with the overall rating. They get an 8.2 out of 10 compared to the state, which is 7.3. So if any of these measures are interesting to you, you can flag it. There are a lot. But anything you flag, we'll just highlight it and it'll stay highlighted so you can come back later on and kind of remember what you thought was important during your search. So we can keep scrolling. Anywhere you find red links, you can dig. There's more information so you can see a full report for this facility. You can see a full report for the state of Maryland. Just depends on the granular level and how far you want to research. There's also information for staffing. This is really important. How much time is the staff spending with the resident or with the patients? And so if we compare the facility to the average of Maryland, it's pretty similar. They get a 3-star rating up here, so about average. And we can keep scrolling. There's some more quality measures. I won't go through each of these. You kind of get the gist. We've got staff vaccination rates. They have a pretty low vaccination rate for flu, about 30% or about a third. And then again, we can see some available services and resident characteristics. This just gives you a flavor of the makeup of the types of residents that live in the facility. Okay, and so again, each nursing home has this type of profile page. But if we go back, I still have my filters on for this Largo zip code within 10 miles. So let's say we are interested in Genesis Doctors community. And then I'm just going to randomly pick one. I'm going to go Villa Rosa. We can check each of these, and then we can click this compare button. So you can choose up to 5 facilities. It gets a little bit hard to see for these types of web demonstrations. So I just chose 2. But now you'll see a side-by-side comparison. So all of that information I just shared with you, now you can quickly scan each facility and see how they compare to each other. And so we've got, it's the same information, a little bit of a different display, some graphics, we've got some more color, you'll see some more icons. Genesis Doctors, you can see, has some more red hearts, the green bar is a little longer, and the star ratings actually are the exact same. And so you'll see some more information about deficiencies, those available services, some of those basic resident characteristics. And if you recall, we looked at family satisfaction, and I highlighted these top 2 measures, and they have stayed highlighted. And so now we can see how each of these compare to each other compared to the state. So Genesis Doctors Community performs better than Villa Rosa, and then also better than Maryland. Okay. And so the hope is that after you use this website, you can start with your basic research, confer with your families, and kind of figure out the best location for mom or dad. It's a starting point. And so we also have some additional resources to help you continue that search. And so earlier I covered I covered some of these resources here at the top. So I'm going to go over the long-term care planning toolkit. So if I click here, we have what's called the long-term care toolkit, and it says brochure. It's also available in Spanish. We have a printer-friendly version as well. But it is less of a brochure. It is a comprehensive 10-page, I hope you can see it. It's a comprehensive document, things to consider. What is long-term care? How do I have the discussion with my family? What are my wishes? What are the difference between different types of long-term care? So lots of really great information. There's also at the end some community-specific resources, different websites, different hotline numbers, that sort of thing. And so that's the toolkit. We have some checklists. So sticking with our nursing home example, maybe mom fell and maybe mom needs a nursing home quickly. Maybe you don't have a lot of time. Home is not a safe place for her to go directly from the hospital. So maybe you need to make that decision quickly. You can use this choosing a nursing home immediate need. And this will give you a PDF. All of these different things you can consider. You can print this out. You can take it to the nursing home as you view. You can check, does it have it? Does it not? And so all of these resources are to help you make those informed decisions. And so we also have some guides, maybe FAQ documents, short and sweet. Maybe you want to learn more about Medicare. So these again are all meant to be printable. A lot of people don't like looking at their phones for this type of information. We did community focus groups, and a lot of people said we want to print it. So we made that available. Again, more information on advanced directives. What is it? How to create your own. And then financial planning. This is a really important part of planning for long-term care. So the hope is, again, that you can use this information as your starting point, or maybe you're a family member is receiving care and you're unhappy with it. Maybe you need to go back to the drawing board. And this really is a tool to be able to use and do that as well. And so I want to go back. So we use nursing homes as our example because this is where you tend to have the most choice in your healthcare. But if you look at any of these other icons or settings, it sort of follows a similar pattern. So if we look at hospitals, for example, again, you get those sort of, where do I start next? So we're going to say, I need to find a hospital near me based on. And now we've got a couple of different options as well. So maybe you need cardiac care, so you need a specific condition or procedure. You could start here. I'm going to use maternity care because sometimes you do have an option on which hospital to choose. And so again, we have these filterable options. I'm going to choose Prince George's County, sorry. And so now I filter down. And so you're really lucky in Prince George's County. You have 4 hospitals. You are also geographically very close to Montgomery County, Southern Maryland counties, and also DC. So you have a lot of options. We don't have DC data because we work for the state of Maryland, but we do have all of the Maryland hospital information. And so since we filtered down by Prince George's County, Fort Washington and Doctors Community, they do not do deliveries. So you'll see there's no data. But we do see data for MedStar Southern Maryland and University of Maryland Capital Region. And so we can see some of these different measures. There's percentage of births that are C-sections, both around 1/3, and then some additional measures as well. And similar to the nursing homes, you can click on a profile page for hospitals, and we see some of that different information that's available. And so if we stick to that kind of mother and baby category, you can see a lot more measures. And then you can also see how the hospital scores compared to the state, compared to the nation. And we have some little legends up here that help you figure out if it does better or worse or about the same. Okay. And so we also have some information on charges, hospital charges, and we can see that normal newborn, vaginal delivery, cesarean delivery, these are some of the most common, it's not really a condition, but those are the top reasons for admission. And we can see the number of cases at the hospital, the average charge, and the average length of stay. And we do have an option to look at that information for the entire state as well. So if I go home, I can go back to this quick link, the price comparison, and I can choose hospital inpatient medical conditions. So this is just for the first half of 2024. And now I can see these are the most common conditions in the state of Maryland. And you can see again, the number of cases, average charge per case, average length of stay. And if I expand out, I can see this information by payer, but also by hospital. So if we stick to those Prince George's County hospitals, we've got, again, MedStar Southern Maryland, and then we have University of Maryland Capital Region. So we can see that there are about twice as many births at Capital Region compared to Southern Maryland. Okay. And one more thing I want to show you, because it came up a little bit earlier about appropriate level of care, we do have an urgent care tab that you can click on. And so if you need to find an urgent care center based on, let's do county. And if we choose Prince George's, so this will list all of the urgent care centers in Prince George's County. If you need to refer anyone to an urgent care center, or if, you know, in lieu of the emergency department, we do have this inventory. To our knowledge, this list doesn't exist anywhere else in the state. So this will be the most updated and most current. So please definitely feel free to use this as you work with your communities and try to get them out of the ED and into more appropriate levels of care. Okay, so I've done a lot of talking, and so we kind of wanted to open it up to questions. You know, we want to hear how this could be helpful for you, how you can use this in your communities, and also how can we improve our website? What would be helpful that you would like to see? And I know it's hard in a quick 20-minute demo to know all the types of information we have, but if you look at this website on your own time, and maybe you're looking for something that you don't see, let us know. We kind of see this as just always in progress. We never think it's done. And we don't want to assume that we know what you need. We want you to tell us as well. So we want this to be collaborative. And so with that, I will stop talking and I will open it up for any questions.
I don't have any questions, but I'm sorry I didn't raise my hand, guys. But that is some good resources for the communities to help the individuals, and we can pass it on to someone. I know I can pass it on some individuals and families, and even myself that needs this information where I can search. You know, we do know about the hospitals. I have several people that's been in the hospital emergency room for 2-3 days before they even got to see anyone. Some have been leaving the emergency rooms because they sat too long. Some has been in the emergency room for 3 days, then been placed into a bed, and then released not long after that. But this is some good information that I can pass on to my community and individuals that gives me a call, you know, off work time, that need help for resources. So I think this is some good information.
Good, thank you. And this is also kind of a great segue into, we're happy to give demonstrations to if you have different organizations or you want us to come talk to your agency or community health workers or whoever it may be. We have a team, we are always kind of willing and ready. So please also feel free to reach out. We are very happy to do this individually as well. I think the more people we can reach, the better. Unfortunately, not a lot of people know about this website, so we do what we can with marketing and webinars, and we try to reach different groups. But we are always just, again, willing and able. If you'd like us to come out, we definitely can.
Thank you, Courtney. Jay, I see your hand.
Thanks. Also, not a question, just appreciation. This information is completely blowing my mind. I work in the homeless services continuum of care in Prince George's County, and the case managers at emergency shelters, outreach teams, drop-in centers are frequently doing care coordination for the homeless clients that we're serving or people who were recently homeless that are in our housing programs. And especially with the rapidly aging demographic that is becoming homeless and the increased age of our homeless population, we often talk about in our case conferencing meetings the need for connecting people to assisted living, nursing homes, urgent care. The fact anytime there can be a centralized registry of information, it makes case managers' life easier. And the fact that this exists, I'm drafting the email right now to notify the entire 150 people that are on the mailing list for our case coordination team. And I will reach out to you to come and do a presentation because we have a biweekly case conferencing meeting that this information would be extremely helpful. So I will reach out.
Perfect, thank you.
And Dr. Cooper?
Extremely informative, and thank you so much for sharing. But I'm going to also address a lot of these resources are they based on the ability to pay? Because we have a lot of individuals within our populations, and we can see as we can landscape is pivoting in different directions, and the ability to pay. So do we have that kind of information that's accessible as well? So when we make the referrals, we can maintain that continuity and coordination of care without any sort of financial barriers.
So this is, it's a resource, and so it is a tool. And so some of it, yes, the prices are going to matter. And so hoping that you could use those daily room rates as a starting point. But all that information also changes as well. So it's maybe a starting point, but also reach out to that nursing home. If you have a couple of options, you would need to call them and find out kind of feasibility.
Okay, thank you. And will your contact information be placed in the chat? And I know Taylor's great as far as providing information in our notes and follow-up, but this is, again, a good resource I would like to share with our community providers as well.
Yes, so I will put my contact information in the chat. I also have it in the slides that I couldn't get to show up. It's my contact information, but we also have a general mailbox where the whole team checks it. Your email will not go into the abyss if you contact us. And so I also, in the slides, if you want to share it with colleagues who maybe couldn't join today, we have kind of screenshots on how to do some of these things, how to find, how to compare. So also if English is not a first language, we find that images are really helpful as well, kind of highlighted arrows. So we do try to make sure that we are kind of accommodating in that aspect as well. So yes, contact information, slides, everything will be available to you. And I think my colleague Stacy just put our team email address in the chat. And then I also see a couple of questions in the chat. How often is the data updated? So that's a great question. So this sort of depends on the data source. So CMS measures They kind of vary. Some are quarterly measures, some are annual measures. So when CMS data gets updated, we update our data. And for different surveys that we do, it might be annually. So as soon as that survey is done, we update our website. So it's kind of ongoing. It's not like we do one refresh and call it a day. We are always updating data to make sure that it is the most accurate and up to date with what's out there as well. And so there's another question, I think, as there is the ability to compare costs. Is it accurate that hospitals are regulated on what they can charge? And if it is true, is that communicated here? So the costs that we have, for example, for hospitals, we are a rate regulated state. So we are a little bit different than the rest of the country. And so the data that we report is what is charged in the HSCRC case mix data for Maryland. And so, of course, whenever you're talking about costs for hospitals, it's also great to talk to your insurance company as well. These are just hospital charges. They don't include provider charges and other kind of fees that might show up. So it's kind of a guide. It's definitely not a Bible.
Any other questions for Courtney? She did include her information in the chat as well as Stacy. So thanks. I think this was a great presentation. And as you can see from the feedback and the questions, I believe this is very useful for everyone on the call. We really appreciate it. I'm just amazed as well with all the resources and the data here. And I can definitely understand the CHWs being very grateful and case managers, as Jay mentioned. I'm sure you will be getting emails from us and from others to be back to do a demo and to provide additional information. Thank you so much. And I'm going to turn it over to Teller and Dr. Carter.
Thank you so much again, Courtney. Everyone on this call, please think about how this fits into your care coordination workflows. If you have any idea, please bring it back to the work group. We will continue this discussion. Hopefully, we want to continue introducing these resources so you all are aware and are able to add this to your workflow and hopefully make the lives easier for those care coordinators and those community health workers. We're going to go ahead and jump into our community announcements. So our friends at the Prince George's County Library, they are hosting in Hyattsville the Horowitz Center for Health Literacy. We are big fans of the Horowitz Center for Health Literacy. They will be presenting on plain language standards and language access in your community. So anyone who is interested, this coming Tuesday, April 29th at 1 p.m., they will have a presentation to introduce the Maryland Consumer Health Information Hub. That's that state mandated plain language requirements. So you'll get to learn a little bit more about health literacy and plain language standards as it relates to healthcare organizations and providers. So I will be sure to send out this registration information in our meeting notes for those who are interested. Next, our friends over at the Maryland Cancer Collaborative, they are having a training opportunity actually in the health department's backyard at 1801 McCormick Drive, taking place on Thursday, May 8th. This is pretty much all day training from 9:30 a.m. to 2 p.m. To learn specifically about direct patient care quality improvement, population, and healthcare administration as it relates specifically to cancer. So there will be different guidelines and benchmarks presented, tools, resources, and promising practices. So anyone who is interested in this train the trainer opportunity, this will also go out in our meeting notes as well. Lastly, we shared a few weeks ago, we have our community health worker cohort opportunity live. This is now launching our Spanish-speaking community health worker cohort opportunity. So I will share out the information, anyone who is interested in registering. I believe it is a free training opportunity for anyone who lives or works in Prince George's County to become a certified community health worker. And so this will specifically support those who are Spanish speaking here in Prince George's County. And I will include this registration information again in our meeting notes. Otherwise, that wraps us up for our community announcements. We will convene back on Thursday, May 22nd. This is going to be a really awesome, another awesome meeting. Our friends over at Just Neighbors is going to present. They are coming to present on their immigration toolkit, some of those resources to best support immigrant communities. So this is going to be a training tailored for healthcare providers and anyone who are supporting the social needs of Prince George's County residents to understand immigrant rights as it relates to HIPAA, constitutional rights, and any other rights that they need to know when providing care. So this is a very important training that they are going to offer for the first time to Prince George's County. So please invite all of your contacts, anyone who you think would be interested in this opportunity, please invite them to attend this meeting again next month on Thursday, May 22nd at our usual 11 a.m. hour on Teams. And Sharon, I see your hand.
Hi, Taylor. Thank you. You just answered my question. I was going to ask if I can share this out to other people, because I know that this has been kind of a continuous concern for people working at the health centers and other places.
Please do. I will send out the meeting invite, but everyone should have access to it through your calendar. So feel free to forward it to individuals who you know. And then I'll also put together a little graphic for folks to share, again, with the purpose of the meeting and that meeting location. Ms. Denise, I see your hand.
Yes, do we have like a minute to share some upcoming things that CECG is doing?
Of course, go for it.
Okay.
And you're on mute, Ms. Denise. Amanda, if you're speaking, we can't hear you. Still nothing. Nothing on my end. I don't know if others can hear.
Okay, you want me?
No, we can't hear it. I don't know if she wants to put it in the chat.
Okay, we have a partnership with Panera Bread where we're getting bread, all types of pastries, and it's called Harvest of Loaves. See if we can get somebody to give you the information for our clients that come to pick up some bread, but they have to register with our QR code. We also purchased a refrigerator from Harvest of Loaves as well to store the for the bread, and we're getting a lot of bread 7 days a week from Panera Bread that we are picking up. Also, we have CompTIA, which is an IT training coming up for anyone that's interested on May the 14th, 6 p.m. to 7 p.m. It is training opportunities and they can how to renew the certification and stay updated with that as well. And that's a training online. Also, we started a class for Microsoft Pro. That class has already started the early part of this month. That was 6:30 to 8:30 p.m. So we do have training classes that's coming up. We also have resume writing here on Fridays. If anyone interested, they can contact us. But I believe the classes, I know the Microsoft Office class has already started. So we're doing a lot of training classes here with CSCG. So I just wanted to share. Thank you.
Thank you, Ms. Denise. Would you mind putting your physical location, the address of your location in the chat for folks to engage with that opportunity for the Panera Bread?
Sure.
And it sounds like you guys have a flyer. So if I could get that from you, Ms. Denise, I'll be sure to include that in our meeting notes as well.
Okay, thank you.
All right. Any other community updates or any community announcements?
Taylor, did we want to speak about the funding support letter that the Health Equity Work Group is working on?
Sure. Go ahead, Dr. Cooper. I am looking for the link as we speak.
Okay. With the Health Equity Work Group, we have composed a letter to actually show support for funding which we're on the verge of funding cuts for the county. And as we all know, although, the changing or shifting landscape has called for various cuts here and there, our needs, the reality is the needs of our community still exist. That said, we as a group have crafted a letter that we will be sharing with our council members as well as our community leaders, and enlisting the support of funding increases for those particular services that help to serve our vulnerable populations. We're asking individuals, you can sign as an organization or as an individual to show support that the impact or the implications of the drastic funding, how it would not only impede our healthcare infrastructure, but other areas of social determinants as well. So Taylor has so wonderfully placed the form and information in the chat. So please, if you have the opportunity to read it over, please do so. Share it with your family, friends, and other organizations that you're involved with. Because again, when we talk about the infrastructure that exists within Prince George's County, we're looking to not survive, but to thrive and build sustainable resources that we can allow for sustainability. So, and thank you. And Sharon, you may be able to add a lot more than I have to this conversation. Thank you.
If I could make a pitch for this, since part of our conversation today was about utilizing the emergency departments in Prince George's County for ambulatory sensitive conditions where people shouldn't be going and don't get the best care for those conditions. The county has been funding a program called Health Assures, which subsidizes care for uninsured and uninsurable residents in Prince George's County. The program was originally, it was underfunded at $5 million. It only covers services for half a year. And then after that, clients have to pay the sliding fee scales at the clinics, which do go to zero, but still they're asked to pay out of pocket after that. Well, they cut that program by $4 million, which means that the funding is down to $1 million to be distributed amongst 6 federally qualified health centers to cover some visits. And it's not going to cover very many visits at that rate. And the biggest issue is that with all the federal cuts and threats to Medicaid, is that the health centers stand to lose federal funding as well, and they operate with very small margins. And the concern is that without the subsidy is really important to them right now, and without that, we'll start to see capacity decrease. You may see reduction in hours, and at least a few of the health centers who serve a large part of the immigrant and migrant communities may have to close their sites in Prince George's County. So it's really, really important that to maintain the level of effort and the county subsidy for these health centers. So that's my pitch. I'm happy to answer any questions. And, the more letters that get sent, the more sign-ons we do, the better to raise this to the attention of the council members. It is, in fact, it could potentially be a matter of life and death for many of the residents.
Yes, and that link is in the chat. If you go to that survey, you will see a link to the letter in Google Docs. So everyone should be able just to download a PDF. Feel free, if you want to submit the letter individually to your council member or get together a group in your own social circle and sign the letter, feel free to do so. Or you can sign on to the effort that has been organized by many of our community partners across the coalition. And if you want to be a part of that effort, go ahead and fill out that Google form with information if you want to sign on as an organization or if you want to sign on as an individual. If you're signing on as an individual, we're asking for folks to put their district information so we can acknowledge those Prince George's County residents. But again, feel free to put whatever information you feel comfortable sharing to be added to that letter. Any other community announcements before we wrap up today? Alrighty, well, thank you everyone for sticking with us an additional 11 minutes. Hope everyone enjoys their lunch hour. Thank you again so much for joining us this month, and we look forward to seeing you for our May meeting. In the meantime, let us know if you need anything, but otherwise take very good care.
Thanks, everyone.
Thank you, everybody. Have a
Bye.